Hello and welcome to the National Press Theatre. Before we begin, we have a few important measures to share. All virtual participants must use a headset and microphone that is approved by the Parliamentary Service. If your headset is not an approved model, you will not be asking questions. If you have a safety, this is to ensure the safety of the services. To avoid to avoid disruptive and potential hazardous audio feedback that could result in injury, we ask all in-person participants to keep their earpieces away from the microphones at all times. If you have any questions, keep your earpiece away from the microphone. These measures are in place to protect the health and safety of all participants, including the... Thank you for your cooperation.
Bonjour tout le monde. Alors, je suis très heureuse d'abord de vous accueillir sur le territoire non cédé de la nation Algonquin-Anishinaabe. Et je suis aujourd'hui très heureuse d'être entourée de la ministre Gull-Masty, ma collègue, l'administratrice nationale de la santé publique, le Dr Reimer, et Kevin Brosseau, notre czar du fentanyl. Merci à tous d'être ici aujourd'hui pour cette importante mise à jour. Across the country, the opioid crisis is visible and devastating. I felt it in Vancouver's downtown east side when I visited in January. I've seen it in Winnipeg, in Toronto, in Ottawa, and Montreal. And the situation is also difficult in smaller urban centers and northern communities like Thunder Bay and Whitehouse. Too many cities and communities are haunted by stories no one should have to tell. Those stories demand our attention and action. People are calling for more results, better support, and real hope for recovery. Prévenir les méfaits et aider les gens est également important pour notre économie. Lorsque les Canadiennes et les Canadiens sont en santé, ils peuvent contribuer pleinement à notre société. Ils peuvent fonder une famille et peuvent réaliser leur plein potentiel. Le coût économique global de la consommation de substances au Canada s'élève à environ 50 milliards de dollars par année. 7 milliards rien que pour les opioïdes. Et cela coûte des dizaines de milliards supplémentaires en perte de productivité. Just over a year ago, I was appointed as the Minister of Health. That responsibility came with a solemn commitment to the families of those struggling with addiction and to the far too many we have lost. The crisis is complex. The toxic drug supply and substance use are rooted in many social factors: mental health, housing, poverty, trauma, and access to care. Complexity is not an excuse for inaction. This work is shared with community organizations and frontline workers, with cities and municipalities, with provinces and territories, and with Indigenous partners. At the federal level, departments and agencies are coordinating efforts alongside those partners, including with the colleagues with me today. Today, PIAC released the 2025 Opioid Annual Report. Over the last year, we have seen a 23% national decrease in drug toxicity deaths. This builds on the 17% decline in 2024 compared to 2023. Those declines are real progress, but deaths remain far higher than a decade ago. Donc aujourd'hui, le rapport annuel sur la crise des opioïdes montre une baisse de 23% des décès liés aux opioïdes. Cela s'ajoute à une baisse de 17% en 2024. Malgré les progrès, le nombre de décès demeure beaucoup plus élevé qu'il y a 10 ans. Les tendances varient toujours d'une région à l'autre. et notre combat est loin d'être terminé. Comme je l'ai dit, c'est une situation complexe et pour nous, c'est un combat permanent. Synthetic opioids like fentanyl and other toxic drugs are causing harms in our communities. This is why our government has taken concrete steps to detect and disrupt the illegal drug trade. In December, we launched the National Wastewater Drug Surveillance Dashboard to provide near real-time detection of drug use, both legal and illegal, and enable community-level action, including local drug alerts, so people are informed of what is circulating in their communities. Le marché des drogues illicites est en constante évolution. C'est pourquoi, au cours des derniers mois, nous avons veillé à la mise en place de contrôles permettant la saisie d'opioïdes synthétiques dangereux à la frontière. En veillant à ce que nos agents des services frontaliers disposent des outils nécessaires pour saisir les drogues illicites, nous contribuons à empêcher ces substances dangereuses d'entrer dans nos communautés. Et le mois dernier, nous avons ouvert des centres d'analyse des drogues à Toronto et à Vancouver. Ces centres renforceront notre capacité à analyser des échantillons de drogue et ils nous aideront à mieux comprendre où les drogues sont produites et comment elles sont distribuées. Ces nouvelles informations nous aident à lutter contre la menace que représentent les drogues illicites. Cependant, la situation reste difficile dans de nombreuses communautés. Les gens ont également besoin d'avoir accès à des soins et un accompagnement qui tiennent compte de leur réalité. Over the last year, 180 local organizations received $145 million to deliver urgent health services, social supports, and culturally grounded programs that save lives every day. This helps people accessing culturally safe care and treatments where and when they need it. Care in communities, care in shelters, care at youth and Indigenous centers. However, there is no silver bullet to solve this crisis. Dogmatism and one-size-fits-all approach are not the right approaches. Provinces have taken different directions on supervised consumption sites. Some have expanded services, others have closed sites, and some have placed restrictions on locations. Health Canada does play a role in providing exemption and supporting public health responses. But it is not for the federal government to impose or dictate local implementation on these sites. Santé Canada continuera de collaborer étroitement avec les provinces et les territoires pour aider à faire face aux crises particulières qui touchent leur communauté. This is a Team Canada effort. Together, we must reduce stigma so people seek help without shame. We must also support people at every stage of their recovery journeys. I want to thank our provincial and territorial partners who are in charge of delivering services. Thanks to the people on the ground who are fighting this fight and saving lives every day. Thank you to CBSA officers who work to stop drugs from entering the country. Merci aux agents des forces de l'ordre locales qui luttent contre le trafic des drogues dans les rues et viennent en aide aux personnes en situation de détresse. Et merci aux travailleurs sociaux, aux infirmières et au personnel de première ligne dont la compassion et le dévouement permettent de prodiguer des soins et de sauver des vies. Merci et je vais maintenant passer la parole à ma collègue, la ministre Gull-Masty.
Merci, Minister Michel. Wajak bonjour, hello, good morning, everyone. I'd like to thank my colleagues, my partners, and everyone who has chosen to join and participate today. Merci d'être ici avec nous. Chaque matin, partout au pays, il y a des communautés que les familles se réveillent avec le monde qui vit une expérience touchée par la crise de drogue toxique. Every day across the country, communities and their families and people are waking up with a lived experience affected by the toxic drug crisis. We are the ones speaking for them today and acknowledging that they have shared with us the lived reality of the situation. For many Indigenous families, the effects of this crisis are not only immediate, they are personal, but also everlasting. Indigenous communities continue to bear disproportionate burdens of high rates of overdose, substance use harms, mental health challenges, and suicide. Les communautés autochtones continuent d'être affectées de façon disproportionnée par la crise de drogue toxique. It is an issue that is shared with me consistently by Indigenous leaders across the country. According to a 2023 report from the Chiefs of Ontario and the Ontario Drug Policy Research Network, First Nations people in Ontario were 10 times more likely to visit a hospital for opioid-related toxicity. This reflects a disparity that demands continued action and partnership. Research also shows that Indigenous peoples accounted for approximately 10% of overdose deaths, while only representing 2.6% of the population, according to the Canadian Medical Association Journal. This is truly a sobering reminder of the inequities that continue to affect Indigenous communities in Canada. Behind every one of these statistics is a loved one who is missed, a family carrying unimaginable grief, and people supporting one another through healing. Derrière chaque statistique, il y a une personne qui manque dans sa famille, une famille qui vit un deuil immense et des gens qui s'entraident sur le chemin de guérison. Many of these people are mothers, fathers, and sons and daughters whose lives have been tragically altered by a crisis that continues to devastate their families and their communities. In some communities, the toxic drug crisis has escalated to a point that local leaders have been forced to declare states of emergency to respond to its profound impacts. In moments like these, Indigenous Services Canada works with communities to mobilize supports, strengthen frontline services, and help ensure people can access the care that they need, where they need it, when they need it. Over the past year, we've been able to expand community-led mental wellness and substance use supports in First Nations and Inuit communities. This includes increased access to naloxone, virtual treatment options, and stronger partnership to improve access to care. Each year, approximately 54,000 Indigenous people receive mental health counseling, 4,000 access substance use treatment, and 20,000 receive opioid agonist therapy programs supported by Indigenous Services Canada. Plus de 1000 travailleurs communautaires offrent des soins et des soutiens adaptés aux réalités culturelles. Many of these traditional and community healers are essential and work directly with their community members. These programs aim to provide wraparound support spanning from prevention, harm reduction, treatment, and recovery into helping people access care closer to their homes. They include counseling and aftercare, pharmacotherapy, and much more. Earlier this year, I had the opportunity to announce a historic $630 million over 2 years to strengthen access to the network of 45 substance abuse treatment programs providing culturally relevant care, wraparound services for opioid agonist therapy at 83 sites, serving more than 100 First Nations communities, including 67 mobile mental wellness and crisis response teams reaching 390 communities across all regions. At the same time, I want to be clear that we know much more needs to be done. Les partenaires autochtones continuent de demander des mesures plus fortes et plus soutenues. Addressing this crisis requires comprehensive, coordinated action at every level. La guérison, ce ne vit pas de la même façon dans chaque communauté. Approaches undertaken must reflect the unique needs and priorities of each community, and communities are best placed to define what healing looks like for them. This is why Indigenous leadership must remain at the center of this work. They are truly our strongest tool and asset in creating and supporting a plan for their members. Across the country, Indigenous partners are driving solutions grounded in their culture, in their language, and in their community. Through initiatives such as Health Canada's Emergency Treatment Fund, our government is supporting community-led projects that will improve access to services and reduce wait times. Last year, this initiative provided over $70 million to more than 90 projects supporting municipalities and Indigenous communities across the country. While governments work to address the illegal drug supply, our responsibility is to ensure people can access the care and supports that they need when they need them. On va continuer de travailler avec les partenaires autochtones pour élargir l'accès des services dirigés par les communautés. C'est le temps d'accélérer nos efforts. Because at the center of this work are truly people, families, and communities who deserve timely, culturally relevant supports closer to homes. We owe it to them to continue this work with urgency, compassion, and determination. Miigwech, merci, thank you.
Ministre, collègues, membres de la presse, merci de me donner l'occasion de m'adresser à vous ce matin. Les données publiées aujourd'hui par l'Agence de la santé publique du Canada au nom du Conseil des médecins-chefs de la santé publique offrent le tableau national le plus complet à ce jour de méfaits liés à la consommation de substances au Canada pour l'année 2025. Elle montre que même si la crise de drogue illégale continue d'avoir une incidence profonde partout au pays, nous observons des signes encourageants de progrès et de preuves que nos efforts collectifs portent leurs fruits. De janvier à décembre 2025, le Canada a enregistré 5 608 décès par intoxication liée aux opioïdes, que se traduit en une moyenne de 15 par jour, soit une baisse de 23% par rapport à 2024. Nous avons également constaté une baisse dans les autres indicateurs de méfaits, notamment une diminution de 12% des hospitalisations liées aux opioïdes et une baisse de 5% des visites aux urgences. While these decreases show that we are moving in the right direction, the reality, as you've already heard, is that these numbers remain unacceptably high and well above pre-2020 levels. And we must not forget that behind every number, every statistic is a person. Every overdose is a tragedy, causing profound and lasting trauma to families, to friends, and entire communities. And this is why we cannot lose momentum. Sustaining this progress and bringing these numbers down even further will require continued coordinated action. A key role of public health surveillance is to translate data into insights that help guide responses, pointing us towards more effective interventions. For example, today's data show a 9% increase in emergency medical services responses nationally, with significant rises specifically in Alberta and Saskatchewan. To better understand these trends, we work closely with provinces and territories to analyze real-time data and identify emerging risks. These data reveal that an increased presence of fentanyl analogs, benzodiazepines, and medetomidine in the illegal drug supply may be contributing, as polysubstance overdoses often require more complex interventions. These findings help inform clinical guidance and frontline interventions. Similarly, our analysis showing that benzodiazepine involvement in opioid deaths has risen from 8% in 2018 to 34% in 2024 is directly informing how overdose responses are adapted. It reinforces the need for enhanced training, updated protocols, and broader harm reduction strategies. data are helping us track shifting substance patterns. While stimulant-related deaths declined by 31% nationally, some jurisdictions are now reporting higher stimulant-related deaths than opioid-related deaths. And so these insights help governments and communities adjust prevention, treatment, and outreach efforts to save lives. Les progrès que nous observons reflètent des efforts combinés sur de nombreux fronts, notamment l'élargissement de l'accès à la naloxone et l'amélioration de la surveillance de l'approvisionnement en drogue illégale. Mais les progrès restent fragiles. L'approvisionnement en drogue illégale reste toxique et imprévisible, et la situation évolue rapidement. La diffusion rapide des données et la collaboration avec les partenaires provinciaux, territoriaux, municipaux et autochtones sont indispensables pour assurer une meilleure surveillance et que les données se traduisent en action par l'entremise de surveillance des surdoses en temps réel, des alertes rapides de santé publique et des capacités d'analyse des drogues. Nous soutenons les interventions coordonnées sur le terrain en matière de santé, d'action sociale et de maintien de l'ordre qui tient compte des réalités locales. On a personal note, earlier in my career, I had the privilege of co-leading the development of the take-home naloxone distribution program in Manitoba, as well as a drug alert system. And I'm proud of the success of the program in preventing both programs in preventing opioid overdoses and reducing harms. And specifically, as we've already heard today, that naloxone distribution is a contributor to the reductions that we've seen. But what impressed me the most was seeing community members step up to embrace the opportunity to train themselves and to get the information that they needed to save lives. In a crisis that so often leaves people feeling helpless, carrying a naloxone kit or having accurate information gave them agency to contribute to the safety of those around them. And that experience reinforced for me that the proactive dedication of everyday community members is one of the most powerful components of our collective response. So today's data offer cautious optimism. It shows that when we act on evidence, we can make a real difference. By continuing to work together, guided by data and compassion, we can build on this progress and save more lives. Thank you. Merci. Miigwech.
Great. Merci à vous tous. Bon matin. Je suis Kevin Brosseau. Mes remarques vont être assez brèves ce matin parce que je sais que vous avez beaucoup de questions. La crise de fentanyl, comme vous le savez, j'ai juste entendu, continue d'avoir des répercussions sur les personnes, les familles et renforce les impacts sanitaires soulignés par mes collègues et les ministres. Le fentanyl est un défi mondial, une priorité nationale avec des impacts locaux. Il fait des ravages au niveau des collectivités, des familles et des individus. This crisis is complex and must be addressed by a lot of people working together, as we just heard. It's a public health crisis, and it's also a threat to public safety and security in communities. That's why efforts must work in tandem to maximize results for Canadians, focusing efforts on eradicating supply as well as reducing demand. Canada is responding in a way that includes everyone at the table, as you heard, including provinces, territories, municipalities, Indigenous partners, international partners, communities, police, and public health officials. It's really an across the board effort. Many investments in tools, as you know, enhancing border security, additional resources for police, in addition to the many of the initiatives that colleagues just raised. I guess I'd say that the release of the data today, while giving me cautious optimism, perhaps I'm more optimistic than those who are scientific in nature, gives me hope and gives those officers and people in community and families hope that, in fact, progress is being made. Recognizing, of course, the fight against fentanyl is far from over, with approximately 15 people dying each day. That's 15 families being devastated each day. Canada's strong, collaborative, and effective response provides momentum for our continued action, and look forward to continuing that action moving forward. Merci.
Are there any questions?
Abigail Beeman, CTV News. Mr. Brosseau, I understand that part of your job is to work closely with your American counterparts, and I'm wondering what message you are sending them about the latest data and also how they've been responding recently.
Yeah, in fact, I'm on my way to DC this afternoon to pass on this message firsthand to my colleagues. I guess I'd say a couple things. First, the message is that Canada is a trusted partner in ensuring hemispheric security. This is a North American issue, frankly, fentanyl, with death and destruction being experienced in the U.S. as much as it is in Canada. And in passing on this latest data that I will be doing in person, will be showing that Canada's resolve to dealing with this crisis is in fact non-abating. That efforts addressing supply and holding those who wish to profit from death and despair to account, but also the rollout of significant public health measures are having impact. So that will be the message that I'll be passing on. And I'll say, Abigail, I guess finally, that many of the messages I've been passing on and conversations I've had with American officials have been received positively, that they're seeing great collaboration across at official level, and just simply say that to continue those efforts moving forward.
I'm also wondering, Mr. Brosseau, what you make of the information that in the year since you've been appointed czar, the CBSA has seized less fentanyl in 2025 than it had in 2024.
Yeah, that's a good question, and you know, recognizing, of course, where CBSA seizures happen, incoming largely through mail and courier services, et cetera. I think it's a slight decrease. From my perspective, the drug trade in this country is largely domestic production and for domestic consumption. So I guess I'd say that, you know, and I look forward to engaging directly with the president of the CBSA to find out more around her views associated there too. But the amount of seizures and arrests that are occurring across the country, those are going on unabated. So maybe that means that particular method of transmission is being diverted in a different way. In many cases, you find where you look. And one of the follow-ups I'll have with CBSA is to say, okay, are you looking in the same places, or are you looking at other places potentially that other paths of importation are being followed?
Hi, Ryan Hamilton, Toronto Star. Mr. Mitchell, I'm wondering, given we're seeing this decline in the number of deaths, but at the same time, provinces are making this choice to close supervised injection sites. You said in your opening remarks that is their decision and you respect that decision. If opioid deaths rebound, though, and unfortunately they don't, but if they do go back up, will you get more involved with provinces and encourage them to reopen those sites?
First of all, I would say I'm very involved in my relationship with provinces and territories on that topic. I have regular conversation with my counterparts. What I'm saying, it's the provinces and territories are responsible to deliver the services. I am not on the ground. The federal government role is to provide exemption. And right now we have a number of exemptions that Health Canada is evaluating. But if a province doesn't want to move forward with the safe consumption site, I cannot force them. So my conversation with them, okay, you are closing it, but what are you considering to do? How are you going to cope with this problem? How are we going to resolve it? How can I support you? And then maybe after some time they will get back to the safe consumption. I don't know. But right now, what I'm saying, and this is what I'm saying, there's no one size fits all. Because yes, it saves lives, clearly. I've seen it in Vancouver, it's clear. You know, safe consumption side, people are there, the ambulance are coming all the time, saving lives. I've seen it by my eyes. But at the same time, I am not the one delivering the services. I'm not the one dealing with the communities. So at the same time that, yes, we know it's an evidence-based model, but we also have to consider the realities of the communities and the governments who are putting it in place. And this is why I'm working with them, finding other solutions and I'm not promoting safe consumption side or promoting another model. I need people to be treated and to feel safe and to live. That's my goal. And my role as a federal minister is to support my counterparts. Because as I said, you know, I don't think any health minister would like to have anyone dying in their province. But, you know, there's many different ways for people to react to a problem. And there's a number of realities on the ground also that we have to understand. Because sometimes, as I said very often, you may do the best policies in the world. If people don't understand where you are going with that policy, it can be implemented. It won't give good results. And this is why I think it's very important in this specific case to work closely with the provinces and territories. As with the Indigenous partners, I would say, you know, they have their own way to see how to deal with the culture, the trauma part that is so big in Indigenous communities. So I think we have to be flexible and to be in listening and learn. It's you know, right now we see a lot of new drugs coming in. So maybe next year we won't see a decrease. I hope I will see a bigger one. But it's moving, and we have to adapt all the time. So I think this is what I want to say. We are doing like an update today, and we're all working together. By having Minister Gull here, the public health officer, Kevin Brosseau here, Minister Gull and I, we are working with other ministers. I brought forward like a task force with public safety, Minister I do for trade, Minister Gull-Masty. We are putting ourselves together to reflect on how to best answer to that problem. But it's an ongoing thing. It's not like we don't have the special bullet, you know, to solve the problem.
And then just as a follow-up, Dr. Reimer, are you concerned that overdose deaths are going to go up in the provinces that have eliminated or significantly reduced supervised injection sites?
I think it's very hard to predict what's going to happen with overdose deaths because there are so many factors that contribute at the same time. What we've seen when we tried to understand the decrease is that naloxone distribution stood out as a large contributor to that decrease, but it's more complex than that. It also has to do with what drugs are present, what combinations are present in those drugs, because people never know what they're consuming when they take an illegal substance. As well as changes to the population that happen over time. So I don't know what we'll see as far as changes in the communities that have closed supervised consumption sites, but I do know that supervised consumption remains one important tool along with prevention, along with naloxone distribution and other harm reduction, along with treatment. And I want to see all of those remaining available to people who require services. Je ne sais pas exactement ce qui va passer avec les données de surdose parce que c'est une situation complexe. Il y a beaucoup de choses qui peuvent changer les données. Pour exemple, les substances qui sont dans les drogues illégales, ils changent tout le temps. Et les personnes qui consomment les substances illégales, ils ne savent jamais ce qui est dans les drogues illégales. En même temps, la population change et aussi on sait que la diminution de surdose est affectée pour la distribution de naloxone. Alors, pour moi, c'est important qu'on utilise toutes les choses qu'on peut pour améliorer la situation. C'est la réduction de méfaits, le traitement, la prévention. Toutes les options sont importantes et je veux qu'on ait beaucoup de manières différentes qu'on peut donner pour les personnes qui utilisent les substances illégales.
Question for Mr. Brosseau. You mentioned that that information from Canada on these issues has been received positively in Washington. I was just looking back in the record. There was a real sense of alarm in the Trump administration about fentanyl. I mean, has that abated? Is it on the decline? And what do you have to do? Is it ever going to decline, that concern and alarm? And what do you have to do to get it down?
Yeah, thanks. Thanks for the question. You know, over the course of, since February of last year when I was appointed, and prior to that, in fact, in some significant investments and announcements of investments made with respect to border capacity and tools for policing, et cetera, that clearly has been well received. That all said, fentanyl is a significant issue. It was declared a national emergency by the president, and I would say for sure the law enforcement enterprise and apparatus in the U.S. is very focused on dealing with organized crime, as we are, and those who are engaged in the trade. So what I've committed to and what I continue to do on very regularly is ensure that information is flowing back and forth, that we understand that we have a shared a responsibility to address this issue, because in fact in many cases organized criminals and others don't care about borders. They'll ply their trade wherever a dollar is to be made. And that partnership and working collaboratively at dealing with this is, in fact, the most effective tool. So, have the concerns abated in terms of Canada's actions? I think that those they have been moderated by the fact in the demonstration in clear evidentiary terms about the actions that we're taking and the manner in which we're approaching this collaboratively. Thanks.
Okay, thank you.
First again, page 10 news. So the first question I have actually is that I know that a number of First Nations, including the Algonquins and Pikwakanagan, have declared states of emergency because of the drug crisis. Do we have any numbers on how many First Nations are still under these declarations?
Thank you, Fraser. There are presently 67 First Nations that have declared states of emergency in relation to drugs. Some have also declared states of emergency in relation to other factors such as alcohol, suicide, and mental health. I think this really paints a portrait of the immense impact in First Nations communities across the country. You know, that's roughly it's a little bit more than 10% of First Nations communities that are in state of emergency. And while at ISK, our mandate is similar to that of my colleague, Minister Michel. We are there to provide support, to provide tools, to provide funding. We work very closely with First Nations for them to be able to determine the approach for their members, because there is truly no one size fits all. There are different factors for why there is a presence of toxic drugs in community. There's a different factors for why people are, in active addiction. And most importantly, there's different types of healing. And I think this is something that I really want to stress today is in some instances, you will see individuals choose to pursue healing or, fighting their addiction in their own personal space. And then you'll see some that are engaging in attending healing facilities or treatment centers. And then you'll see some individuals that are working directly with their community healers and going into the bush and going, for very cultural in-depth experiences and opportunity to work with those community members. All of these pathways are legitimate. And one of the factors that I see, the data here of 67 states of emergency, it really demonstrates to me that it is not solely drugs. There are other factors that relate to it, mental health, a lot of the crisis that we see around suicide, and trying to support in the addiction space is a huge undertaking for us. This year, we are constructing 4 treatment centers in James Cree. We are also in Cree Nations Treatment Haven, in Anishinaabe, Nadmagi, Gamik, and Tobic First Nations Center. And of these 4, I can say in almost every single meeting I've had this year, leadership has indicated to me that treatment centers are one of their big capital asks. They need the support for their members. So it is critical that we work together. I fully support the approach that Minister Michel has outlined, this task force, including public safety, really trying to determine how we can support in community and holding up that process by additional measures from Health Canada and public safety. All critical factors. Everybody here plays a role in helping. Everybody here, I think, is committed to that process. While the numbers demonstrate a decline, I think taking a position of, holding and seeing what happens next is a good approach.
Sorry, just to clarify on that, so is it 67 states of emergency total, or is that just because of drugs total?
67 for drugs. Within that, there are communities that have also declared for the other areas, 14 for alcohol, 22 for suicide, and 16 for mental health. Some have multiple declarations.
Okay, thanks.
He has to leave at 11 a.m.
Okay.
Est-ce que je peux poser une question à la ministre Gull-Masty en français sur ce sujet? Qu'est-ce que ça leur permet, cet état d'urgence? Qu'est-ce que ça peut permettre aux communautés pour combattre la crise des opioïdes?
J'ai manqué la première portion du question.
Qu'est-ce que l'état d'urgence peut permettre comme action pour ces communautés?
Merci. L'approche, ça dépend sur la communauté. Mettons, c'est une communauté qui a beaucoup de besoins pour des sports, pour des cas de suicide. On peut envoyer une équipe pour les aider, pour avoir plus de sport dans l'aspect de mental wellness. Aussi, il y a de l'accès à des sports pour emmener, en anglais, c'est comme Emergency Response Teams, pour engager la communauté. Mais c'est pas juste une approche. Il y a des différents besoins. Mettons, il y a une communauté qui ont comme une grande crise concernant l'aspect des drogues. Le focus va être différent d'une communauté qui ont comme une crise de suicide. On va les supporter dans la manière que eux ils ont besoin du sport.
Et c'est quoi les progrès que vous remarquez?
Pour moi, je pense que les progrès sont différents. Il y a des communautés ils ont un focus d'avoir un centre de traitement, ils veulent créer des programmes, ils veulent avoir plus de progrès de monde autochtone qui travaille dans ces cliniques ou dans ce niveau-là, dans leur langue, avec des programmes qui sont basés sur les aspects culturels. Mais il y a aussi des communautés qui sont vraiment dans l'aspect d'avoir une approche plus basée dans la culture, pour avoir plus de focus dans des manières de soins comme des pratiques traditionnelles, mais toujours le focus est de vraiment avoir une approche que nous travaillons pour les supporter avec leurs besoins, la manière que eux ils déterminent une approche le mieux pour leurs membres.
Monsieur Brosseau, une question pour vous. Justement, vous avez parlé du lien avec les États-Unis, le fentanyl, le fait que c'est une crise qui est partagée, mais là, avec ces statistiques-là, est-ce que vous arrivez aux États-Unis avec une meilleure posture, avec des statistiques et l'Agence des revenus du service frontalier nous disait il y a très peu de drogue là, qui s'en va vers très peu de fentanyl qui s'en va vers les États-Unis du Canada. Est-ce que ça met notre pays dans une meilleure posture? Est-ce que vous allez être capable de convaincre l'administration Trump que le Canada fait le travail?
Merci. Si je peux convaincre personne, je suis pas certain. C'est pas vraiment mon job de convaincre l'administration. Je peux dire que je vais faire de mon mieux de décrire les efforts qu'on prenne concernant cette crise, soit sur l'offre ou soit sur le demande. Donc, ça démontre le succès, ben ça démontre un degré de succès parce qu'on voit un moins surdose. Ça c'est une bonne, je peux dire, des bonnes chiffres. Je ne peux pas parler du monde qui sont décidés comme des chiffres, mais l'administration est très intéressée en notre travail. La façon dont on gère nos enquêtes, les équipes policières, la façon dont on partage l'information et renseignements. Donc, c'est une partie de la grande histoire de notre travail, puis je pense que ça va être bien reçu. C'est intéressant parce qu'on voit les décès qui se basent aussi dans les États-Unis, parce que c'est presque les mêmes chiffres. C'est assez proche. Donc, c'est clair que nos efforts coordonnés, on a des résultats de ce travail.
Ministre Michel, je veux vous entendre sur la toxicité des drogues. Le benzo, par exemple, le naloxone ne fonctionne pas avec le benzo. Est-ce que vous vous inquiétez que dans le futur, ça va avoir un impact peut-être à la hausse sur les décès?
Ben, c'est pour ça que je pense aussi que la docteure Reimer a dit on ne va pas se prononcer sur ce qui va se passer après. Parce que pour être honnête, les drogues évoluent tellement rapidement. Je pense que les centres que nous avons créés d'ailleurs à Toronto et à Vancouver vont nous aider plus vite tout le temps à voir qu'est-ce qu'il y a dans les drogues. Mais c'est comme une course à la montre tout le temps de ce qu'on change. Et c'est sûr, l'analoxone ne répond pas aussi fort au benzo, mais ça va nous mener à nous adapter, de voir qu'est-ce qu'on va trouver qui va résoudre. Et c'est pour ça que je dis, vous savez, c'est vraiment un combat. Nous travaillons tous ensemble dans la même direction. Je crois que des efforts vraiment que moi j'ai essayé de faire, c'est que, écoutez, moi j'ai été vraiment, quand j'ai été à Vancouver, là, j'ai dit, c'est pas possible. Je sais que c'est compliqué, mais on peut pas rien faire. Et c'est à partir de Vancouver que je me suis assise avec la ministre Gull-Masty, la ministre Aïdou, le ministre Adan Sangaré, et j'ai dit, écoutez, travaillons ensemble, nous déjà les ministres. Ça va aussi permettre à nos départements de se parler. Parce qu'il faut qu'on se coordonne d'abord nous-mêmes au niveau fédéral. Parce qu'après, il faut ajouter la complexité maintenant des provinces et des territoires. Mais nous, déjà, il faut qu'on s'entende qu'est-ce qui est dans notre pouvoir et qu'est-ce qu'on peut faire ensemble. Et c'est pour ça que je pense que le rôle du gouvernement fédéral, c'est beaucoup vraiment l'éducation, la prévention, chercher tous les moyens, par exemple, par les centres, avoir l'information sur la complexité des drogues, ça c'est super important. Ça va nous permettre de voir surtout que comme disait Kevin, c'est qu'il y a, les drogues sont de plus en plus fabriquées ici. Donc avec des choses qui existent ici. Donc qu'est-ce qu'il faut qu'on retire? C'est ça. Donc il faut qu'on travaille de manière très, très coordonnée. Mais j'ai espoir parce que je pense que, vous savez, c'est la force de la collectivité. Je crois que en parlant aujourd'hui, ce que je veux démontrer, premièrement, il n'y a pas de stigma. On n'est pas en train de se battre le torse en disant les chiffres sont magnifiques. C'est pas ça du tout l'idée. Mais c'est pour vous dire qu'on est là-dessus, mais on doit être tous ensemble là-dessus pour faire de la prévention, pour informer la population. Et aussi, nous en tant que gouvernement, ben, on essaye vraiment de coordonner nos efforts.
Marina von Stackelberg from CBC News. Minister Michel, what is your stance on safe consumption sites?
As I already said, safe consumption site, the evidence is clear. It saves life. That's clear. At the same time, I'm the Federal Minister of Health. My department is providing exemptions when provinces and territories are asking to get an exemption. After a number of consultation, there's a lot of criteria. So personally, I would say if all the conditions are in place and Health Canada is authorizing a safe consumption site for a province that is requiring a safe consumption site, I am fully supportive. But you know, more and more you see provinces who don't want to have safe consumption sites. They want to act much more on treatments, So I cannot force a province to put safe consumption site in place. And I do get the challenges. I think, I go a lot on the ground, the more I can, because I don't want to take decision without seeing what is really going on. I like to take the pulse. And I can see the challenges. I can understand. And this is why I'm saying in this particular topic, we need to leave aside dogmatism. We need to understand that people are trying their best because in some cases, some provinces choose to have safe consumption sites. Then they get into a big trouble with municipalities, with organizations, public safety, etc. And it's true. So they are trying something else. So I am there to support whoever is dealing and trying to do their best on that topic.
Oh, can I ask a follow? Dr. Reimer, you talked about the fact that this decrease in overdoses and deaths is fragile. What do you see as working here? What could impact this progress? A lot of this, as you've all mentioned, is a provincial response. So if you're advising the provinces on what they should be doing more of, what they should be doing less of, what would you tell them?
Yeah, and so as I did say, it is fragile. We've seen a decrease for 2 years in a row, but that follows many years of increases, and the number of overdose deaths are still higher than they were before the COVID pandemic. So while it is encouraging, it is far from over. We have far from solved the issue. So what I want to see provinces, territories, the federal government doing, is making sure that there are many options available for people. When people are using illegal substances, they are at very different points in their lives. They will have different needs. Different communities have different needs. And the programs are only as effective as the support from the communities that are providing that care. So I want to see us having a focus on prevention, a focus on treatment, a focus on harm reduction. All of these different areas need to be supported because each individual and each community may have different needs to help them through this and prevent deaths and prevent other harms as well. We know supervised consumption also prevents the spread of bloodborne infections, and it connects people to care when they may be ready for treatment. So I think the most important thing is that we are all working together with the same goal in mind and trying to support communities to tailor the responses to what their community needs.
Two questions for Mr. Brosseau. One and a follow-up. Who will you be meeting with in Washington when you go down there, taking this data today to help make the Canadian case? And how often do you go to the United States to sort of help make the case for Canada?
Yeah, I'll be meeting with officials from a number of different agencies, as well as with the embassy, of course, because they're just such great interlocutors with officials at the various arms of the government of the United States. And I don't travel that frequently to the U.S., but I do interact, through electronic means or calls otherwise pretty regularly. That's a pretty important part of my job.
Some Canadians and maybe even a few Americans might say that the Trump administration's concerns about these matters have been linked to gaining leverage in trade talks and that kind of thing. I mean, as the person who is making the case to them, how do you see that view?
Yeah, I'll leave their people's opinions to themselves. I've said from the beginning, and that Canada isn't a major source of fentanyl to the U.S. That's been clear, and I've used evidence and data as my points of argumentation versus trying to convince somebody who has a particular frame of reference anything about that they may believe. But I've said it, and you've heard it here many times, that we've got a problem in this country with the consumption of fentanyl and deaths and the social disorder that comes along with that in many of our communities. Walk around. So clearly we have work to do, and we'll continue to do that. And the work should continue unabated, regardless of what somebody's opinion is about what Canada is about or not. Thanks, Ian.
Good morning. Sarah Ritchie with the Canadian Press. My first question is for Mr. Brosseau. Given what you and your colleagues around the table here have said this morning about the complexity of the challenges before you, can you help us understand why you've taken on new positions as Commissioner of the Coast Guard and a new position as a Senior Associate Deputy Minister in Defence?
Yeah, it's a real thanks for the question. I'm not alone, fortunately, in the work. My job is really to a couple things. One, obviously, is as you've heard, interacting and coordinating efforts with U.S. and other international partners, but also to be point and lead the efforts from the Government of Canada. So in that regard, and you would have heard from officials from CBSA, Public Safety, RCMP, Health Canada, you pick a number of different departments, and we've created structures in place where that integration, both federally and also domestically, between provinces and territories, actually took hold. And by me taking on this job, interestingly enough, is able to muster up additional capacity to be able to help in that regard. 2/3 of Canadian border is actually maritime, where Coast Guard actually patrols regularly and often. So with the new security remit given to the Coast Guard by virtue of C-22 or C-12, can never remember the numbers, the Coast Guard can actually play a role in the border fight, and while out patrolling and prevent and preserving safety and shoreline protection, can also look for and report to those enforcement officials, those who are trafficking in drugs. So it permits me an opportunity to integrate the various streams of effort across the Government of Canada, and I can walk and chew gum at the same time. Thanks.
Sorry, and our final question, David Aiken from online.
Can I have a follow-up?
Yes, ready.
Thank you. Thanks. Minister Michel, this one's for you on another file on your desk. Is the government in any way considering rolling back or making changes to Track 2 MAID?
Well, as you know, we have a committee in place.
But that's for mental illness, so this is about Track 2.
No, so we are waiting to get the recommendation from the committee. You know, we have a committee in place, and I'm waiting to get the report and the recommendation, and we will look into it. So I'm not ready to talk about it today, honestly.
So I just want to clarify, though, that what I'm asking you about is Track 2. That's the existing regime around medical assistance in dying, not what the committee was studying, which is an expansion on mental illness.
Can you repeat it?
I want to clarify that the committee is studying MAID for mental illness.
Mm-hmm.
I'm asking you about the existing laws in place for Track 2, medical assistance in dying. Are you considering any changes to the existing laws?
No.
Okay, thank you.
And David Aiken, please go ahead.
Get your mic on. Go ahead, just talk in the mic.
Oh, David Aiken, please go ahead.
He's on mute.
Thank you. Just was waiting for the moderator on mute. David Aiken, Global News. Good morning. A question for you, Dr. Reimer. I'm curious if the demographics have changed or are changing for opioid death victims. In other words, more male, less male, more female, unhoused, housed. Are there some demographic characteristics that stand out to you in the existing data, and has any of that demographic data changed over the last little while?
Yeah, that's a great question. We do know that there have been changes to the population at risk that can be contributing to the decrease, but I would be very happy to provide more details around those. I don't have the exact figures in front of me right now, but happy to take that back and get you some more accurate numbers.
Okay, thanks. I'll be in touch. I'm just curious about that. And Mr. Brosseau, so when you're down in Washington, D.C. today, and you probably make this on Zoom calls when you don't travel, but when they ask you, when the United States asks you, what is Canada doing or has done recently to stop the export, I guess, of illegal drugs from Canada to the U.S., what's your response at this point?
Yeah, my response is I go through the litany of efforts and investments and increased capabilities put in place at the border, and it goes all the way through to fentanyl sniffing dog teams from the CBSA, to 1,000 plus for each that'll eventually get staffed up to Blackhawks and across the board, and then finally end up and show what the Border Patrol seizure stats say at the end of the day. And you know, my first day on this job was at a border crossing with then Minister McGuinty, and I was asked the question saying, look, you're trying to reduce multiple, ounces versus pounds. How are you going to actually be successful, in my view at the time? And it remains the same, that there shouldn't be anything going from Canada to the US. And that's the kind of spirit and intent that I've tried to impart upon everybody that's involved in this. And the border goes both ways. So very focused on flows both ways. Thanks.
Thank you, everyone. Thank you. Thank you, everyone.
Have a good day, Charles.
Yeah, have a good trip down.